Welcome to Conversations with Black Doctors, brought to you by the Austin Black Physician Association, also known as ABPA. My name is Dr. Jeff Hutchinson, and I'm an adolescent medicine physician in Austin, Texas. I will serve as the moderator for our panel today. The mission of the Austin Black Physician Association is to improve health disparities within our community and to inspire and nurture the next generation of Black doctors. If you're interested in learning more about or collaborating with ABPA, please visit austinbpa.com to connect with us. That's austinbpa, Black Physician Association.com. The purpose of these webinars is to bring health information to our community from trusted voices in the Austin area. We want everyone in our community to have the knowledge to care for themselves in the best way possible. Please share this webinar widely. Today's topic is talking about GERD, gastroesophageal reflux disease, more than heartburn. This topic is important to the ABPA and the Black community because 1, preventing illness is the best way to take care of ourselves. 2, we should know when it's more than just an upset stomach. And 3, there are treatments that can really make a difference. Joining us today are 2 Austin area Black physicians who are experts on this topic. Dr. Judith Amaning and Dr. Brandon Allport. Thank you both for joining us today.
Thank you for having us. My pleasure.
My pleasure as well.
Before we begin, I need to acknowledge how difficult it is right now to be Black in America. My hope is that both of you and all of our viewers are finding the time to take care of yourselves. It's very important that we take care of our health in order to help other people. As we go forward, could you please introduce yourselves to our guests?
Sure. My name is Brandon Allport-Altillo. I'm a primary care internist and pediatrician, and my clinical practice is at Lone Star Circle of Care at Collinfield, which is a community clinic in North Austin. And I'm also on faculty at Dell Medical School, where I'm an assistant professor of population health, internal medicine, and pediatrics. And I'm also the co-director of the primary care rotation that all of our students go through. And my research interests are around developing ways for doctors to address both health and social needs, especially in primary care settings, because social needs do affect people's health. And the reason I got into primary care is that I really enjoy talking about all different aspects of people's lives, including health-related things and non-health-related things, and getting to know them over the long term. And so in my clinical practice, I do see people just about every day that have reflux and heartburn issues. So it's something I'm very comfortable managing.
Fantastic, thank you.
All right, I'm Judith Amaning. I'm an adult gastroenterologist in the Round Rock Pflugerville area. I specialize with anything from the mouth all the way to the bottom and whatever is in between. My passion is really patient education and empowering patient. I kind of really focus more on collaboration with the patient, of course, management and education as well.
Fantastic. Now, our patients know the term heartburn. In medicine, we call it GERD, gastroesophageal reflux disease. Can you tell us exactly what GERD is? Dr. Amaning?
Yes. So gastroesophageal reflux disease affects a lot of Americans, about 25%. And really, it is feeling the acid regurgitate back into your esophagus. Now, over time, you have these muscles that separate your chest from your abdomen called your diaphragm. And as those kind of get loose, there is a sphincter in your lower esophagus that is closed when you're not eating. With reflux, that sphincter opens periodically and lets the contents of your stomach, including acid, kind of come back up. Your nerves and your muscles in your chest will interpret that commonly as burning, maybe some pain, and then definitely feeling stuff come back up in your throat called regurgitation.
Fantastic. Dr. Allport, are there short and long-term effects of this?
Sure. So a lot of people come to me, and this is sort of the last thing they bring up because it's not really that big of a deal. But for people affected, it can sometimes cause some real problems. It can be very uncomfortable. Sometimes you think it's a heart attack because you can have pain in your chest. So that obviously causes a lot of anxiety and fear for people. It can impair your sleep. It can make it hard to get to sleep if you're having that burning in your chest, or it can be very uncomfortable during the day as well. And it can lead to problems like bad breath, cavities in the teeth, so different oral health issues, as well as hoarseness and pharyngitis, chronically. And then for people with asthma, if there's little bits of that regurgitated either stomach acid or food that get into the lungs, that can worsen asthma, that can cause inflammation or even pneumonia in the lungs. And then, of course, the worst possible outcome that we think about is that it is possible to develop cancer in part as a result of having reflux over a long period of time. Then in kids, as on my pediatric side, it can result in problems with weight gain and a lot of discomfort as well.
So it sounds like something that we should take serious when those type of symptoms appear. Can you tell who's at risk for getting GERD?
Definitely. So when you have reflux, the goal is to decrease the risk factors prior to really starting any medication. So if you think of your abdomen, anything that causes pressure will cause your stomach to reflux things back up into your chest. So if you're overweight or you are apple-shaped, basically you carry your weight in your upper part of your body, you ought to increase risk for reflux. Also, poor sleep hygiene, laying flat right after eating, usually within 2 or 3 hours, will make your acid reflux worse. Now, there are some foods that have been, popular in causing acid reflux symptoms, usually acidic foods, spicy foods. Some people will even say coffee. But technically, those foods don't cause damage or inflammation to your esophagus. They might make your symptoms worse. So if you feel like some of these foods are your triggers, it is not a bad idea to avoid it. But according to the American College of Gastroenterology, stopping those foods won't necessarily cause or improve inflammation.
Great. I know that both of you spend a lot of time with patients, and education is a big part of what we do. Can you share some of the things that patients believe that you have to often help them understand better?
Sure. So I'll go back to my point about children. So one common idea is that GERD doesn't really affect kids, it only affects adults. And it is true that adults are more likely to have reflux, in part because some of those muscles that Dr. Amaning was talking about do weaken over time. But kids certainly do have reflux. And in fact, most babies have reflux right off the bat. But we don't usually call it reflux disease. And the reason for that is that they're usually not really bothered by it. And we call it spit up because it's just so common. We don't call it reflux, but it's spit up, right? And you see a little dribbling of milk out of the mouth, and they are still giggling and happy. So they're not bothered by that. They're not experiencing negative symptoms. And if their weight is also increasing appropriately, then we don't really worry about that because we know that that sphincter will tighten as they get a little bit older. But there are some babies where either they are showing signs that that reflux is bothering them, so they might cry a lot or arch their back when they have that reflux, or they might not have great weight gain. So if they're not absorbing enough of the calories because too much of it is coming out, that's when we kind of do call it a disease because it's causing actual problems. And so that would be a reflux disease that we might treat with medication. But the vast majority of babies with reflux don't need medication. Older kids are less likely to have reflux than both babies and older people, but it does happen in kids too. So that's one sort of myth that I think I hear a lot. Another one is the concern about cancer, so that GERD always leads to cancer. Because when people first hear that, that is something that takes something that we thought was not that big of a deal and makes it almost the biggest deal. And so people tend to really focus on that. But I will say, even though that it is a risk factor for cancer, we know that 25% of people just about have GERD, and not nearly that many develop esophageal cancer. So it does happen, but it's relatively rare. And there's things we can do to prevent that, which we'll talk about a little bit later.
Fantastic. Dr. Amaning, do you have any stories or examples of how you've helped a patient educate them better?
Yes, so a lot of people who have reflux, heartburn, usually just go over the counter and get basic medications like Tums or Gaviscon or even Pepcid or Prilosec, and they'll usually stop taking it if symptoms get better. So a lot of times when patients come to me, they are in severe pain and nothing is really working. So I think you should pay attention to your body. If you are noticing symptoms occurring at least once a week, that means that you need to be on a long-term therapy in a class of medication called proton pump inhibitors, usually like the Nexiums or the Prilosec. So the common misconception is I can only take these for 2 weeks and I have to stop. But you have to weigh the risk and the benefits of the medication. So I like to talk to patients about the potential risk of taking such a medication and then the benefits of it. And like Dr. Brandon had mentioned, you want to prevent esophageal cancer, and some of these medications can really help with any progression of advanced reflux disease.
Fantastic. How do we know if we should see a primary care doctor or specialist if we have those kind of symptoms?
So as Dr. Amaning mentioned, if you have GERD maybe 3 times a year when you eat a really spicy meal and you overeat and you lie down right after, we kind of know the reason for that, and you can kind of take some of those lifestyle measures and maybe take some Tums, and you don't necessarily need to see a doctor every time for that. But if it's something that's becoming a real issue for you, if it's every week or even every day, or you're noticing some of those other effects, like maybe your asthma's a little worse, or you're having some hoarseness, those are times when you might want to see a doctor and think about getting some more or prescription medications to help with that.
That makes sense.
Definitely. So I would recommend seeing a specialist if you start taking the class of medication called proton pump inhibitors. They include Nexium, Prilosec, Prevacid. If you're taking that daily consistently for 8 weeks and you still have breakthrough reflux symptoms, you need to see a specialist. If you have any of symptoms that are a little bit concerning, mainly vomiting, trouble swallowing, maybe some pain, weight loss, or if you've ever heard that you're anemic in addition to acid reflux, you should definitely see a specialist.
Great. Now, unfortunately, all of the people watching, all of our patients aren't privileged enough to be able to see you both as fantastic physicians. They may end up with someone who may not communicate as well. And I like to talk to patients about how can they advocate for themselves? How can they best talk to their provider so that they get the best treatment possible? What would you like patients to know about treating GERD that they should either talk to their provider about or they should be aware of before they go in? What advice would you give someone who is worried about it, but their provider may not be listening to them so well?
I think the first thing that I would say is knowing the treatment options is really helpful because you can kind of know what you've tried before and what is available in the future. Because many of these treatments are available both over the counter or prescription, or there's a different version that is prescription. So we've talked, I think, about 3 basic levels of medication. So one is kind of the over-the-counter antacids like Tums. Another level would be your histamine receptor blockers. So that's something like Pepcid or famotidine, which we mentioned, that you can buy over the counter. And then that other class of medications, which is probably the strongest in this category, is the proton pump inhibitors, which is the omeprazole, esomeprazole, or pantoprazole are some common ones. And the brand names for those are Prilosec, Nexium, or Protonix. And there are different doses as well that you can use for those. So sometimes if it's not working for you, maybe you just need to increase the dose, or maybe you need to increase the medication to switch to a different medication. But the other thing to make sure that you advocate for is that if things are really not getting better and it's causing a lot of problems for you, it can really be helpful to see a specialist, a gastroenterologist, so that you may they may want to do some further studies to see what's going on there.
Definitely. I couldn't have said it better myself. I think those are all reasons, or those are great options to advocate for yourself. Even as a physician, sometimes when I see other doctors, I get taken for granted, you know, and it can be difficult, especially if you're a person of color or a Black woman or Black man. So I think that most physicians should keep in mind that it is your body. You've been with it for over so many years. It's hard for a physician to know you in 15, 20, maybe even 30 minutes. So if you can kind of, you know, talk to them about something is wrong, something feels off, and you have to trust me on that, I think any physician should take you seriously.
How do you feel when patients ask you, is this what you would do for yourself or for your family? Do you appreciate that question?
I definitely do. I think in our generation of medicine is a lot more collaborative. You know, I think old school, the doctor says one thing and you do it, no questions asked. But now with the internet, with education, a lot of people are coming in kind of armed with information. So there's a wrong way to do things for sure, but there's obviously several right ways to do things. So when patients ask me, I like to list out the options, talk about the risk and the benefits, you know, of each, and then which one really kind of fits with you, your lifestyle, and what you have going on currently, whether financially or even socially.
I really appreciate that question too. And you know, going to the doctor for a lot of people is a pretty unique event. It can cause some anxiety. There's something that's bothering you and you want to get that fixed. And I think, you know, I think most people are pretty caring as doctors, but we are human and we do this every day. And sometimes we can sort of in a rhythm or a routine, and we're not really thinking about the impact on the person, especially we're running behind, we're running late, we're trying to catch up. So when you ask that question, if this is what you would do for your loved one, that can really bring us back down to earth and think, oh, we really need to think about this decision for this patient and how it's affecting them.
Great. So just a couple more questions. And the second to last one is, what is the most important thing you would like everyone to know or to do about GERD? Do you have some advice for all of us?
So I guess I can start. So if you have any of the alarm symptoms, and they are usually weight loss without trying, vomiting, trouble swallowing, if you've ever been told you are anemic, if you've ever noticed a change in your stools, maybe it could be dark and tarry, suspicious for bleeding, you should definitely see a specialist. And what we will do is an endoscopy, which really means we take a long, thin tube with a camera at the end of it, go down in your mouth and look into your stomach to look for any ulcers, inflammations, narrowing. It's done with sedation. You're asleep, you don't feel anything, and it's a fairly short procedure, 5 to 10 minutes. It's probably more work getting an IV and giving you fluids prior to the procedure, and it's relatively safe. So I would like people to know that the workup for complications of GERD is really safe, and we're all here to avoid any complications, and it should be covered by your insurance.
Nice.
And I would just say that the biggest thing to know is that there's no reason to treat it like it's not a big deal, because it can have those serious effects. And there are treatments available. So definitely contact your primary care doctor if you're having issues with these symptoms. And it's always good to start with the primary doctor, because they can kind of evaluate maybe if it's reflux that's happening or some other symptom, perhaps controlling your asthma, that's an issue, or some other kind of pharyngitis, depending on the symptoms that you have. And most people can be controlled with their reflux without the help of a gastroenterologist, but they are really essential when things are really severe or when there are other problems that develop.
Fantastic. Do either of you have resources you would like to share for people to learn more about it?
I usually think that the American Society for Family Practice usually has really good general resources for GERD. The Mayo Clinic, has a good resource. If you just click Mayo Clinic GERD, has resources for several conditions, and they break it down so that it's really understandable and it's really informative. So those are kind of my go-to. I also like Stanford University's patient portal. I kind of take it from everywhere to kind of help the patient.
I agree. Mayo Clinic is really good usually. UT Health Austin here at home also has a heartburn and esophageal disorder center. And on the homepage for that, there is some patient information documents. So you can take a look there and learn more about GERD and reflux.
Great. It was fantastic talking to you both. Thank you so much, Dr. Allport and Dr. Amaning. We're so grateful for your time and your expertise. Thank you to the audience for listening in wherever you are. ABPA wants to continue to further its mission to improve health disparities within our community and inspire and nurture the next generation of Black doctors. Please leave comments or send an email to info@austinbpa.com and visit our website, austinbpa.com, if you or your organization would like to partner again with us. Again, that's austinbpa.com. Thank you again, both, so very much.